All right, in the final segment of this introduction, I'm going a little bit deep. We're going to talk about not just breathing, we're going to talk about how breathing can go wrong. Because when you're an EMT, people don't call you because they're breathing well. They call you because they're having trouble breathing. And there's times that trouble breathing gets to the point that they're not breathing enough to support life. That's called respiratory failure. Now, there's some physiology involved in this, and that's what we're going to spend some time doing here, just to teach you about that physiology. Now, what I want to say is when you look at these videos and in the EMT Class Ready program, you'll have the ability to re-watch videos just like you can with this. There's some deep concepts here. Take the time to learn it. Your dedication to learning is really important, and I think we're going to see it here. Now, I'm going to be filling in some blanks here and showing you how we can tell if breathing gets to the point it doesn't support life, respiratory failure. And we're going to show it in a series of numbers. That's going to help you relate this to what you see. Then I'm going to give you a couple of test questions. So here we go. So my lung volumes, we breathe in. Now, just stop for a second. Take a breath and let it out. It's a pretty simple process. We don't think about it all the time. But really, I hope you did that. I wanted you to do that so you could picture it, all right? So when I take a breath in, the amount of air that comes into my lungs is called my tidal volume. In the average adult, that's about 500 milliliters of air. Now, the average adult at rest breathes about 12 times per minute. The amount of times we breathe per minute is called the respiratory rate. So let's say 12. Now, if I multiply these things, that's 12 times a minute, that gives me about 6,000 milliliters per minute. That's my minute volume. That's the amount of air that moves in and out of my lungs in a minute. Now, I'm going to continue and show you why this is important. This is totally fair game for an EMT to know. It's going to tell you why sometimes our breathing, even though we're moving a little air, isn't enough to support life. So as we continue on with this, let's just go 500 milliliters, 12 times a minute gives us 600 milliliters, or about 6 liters of air that moves in and out of our lungs. But not all the air that comes in to our body gets to the alveoli. At the end of our respiratory passages, we have alveoli. Those alveoli is where gas exchange takes place. It's at the very end of our respiratory tree. We have to go through our big trachea, through our bronchi, to smaller bronchioles, till we get down to those little alveoli. As a matter of fact, of that original 500 mLs that we took in, 150 mLs is dead air space. No air is exchanged. So think about my 500 ml tidal volume, and again, ml is milliliters, means that only 350 mLs gets into my alveoli. So now if I take my 12 breaths a minute, that means that I'm going to take this and we're going to take this and call it alveolar volume. The amount that gets to my alveoli is 4,200 milliliters per minute. Now, we saw that we had 6,000 milliliters, but now when I subtract my dead air space, my alveolar volume is now 4,200. That's enough to support life. That's okay. What happens if I start breathing very shallowly? What if my breathing normally is, but instead I'm going, I'm only taking in about half the air. So let's go to 250 milliliters of air tidal volume. My breathing has become very shallow, 250 mLs. My dead air space doesn't change. The amount of tubes I have to fill never changes. It doesn't adjust. It's always subtracted. So now if I have 250 and 150 that's dead air space, If I'm breathing 12 times a minute, that means my alveolar volume is 1,000 milliliters per minute. Now look at this. I went from 6,000, and they say, okay, that's a lot of air moving in and out. Okay, not all of it gets where it needs to be, so 4,200. Yeah, that's enough to support life. That's really good. But now if I take and I cut the amount of air I bring in half, subtract my dead air space, I've gone from 6,000 milliliters a minute for a minute volume down to an alveolar volume of 1,000. And you know what that means? That means I'm in respiratory failure. It's not enough to support life. Now, what will that look like? Because these are all numbers, right? Well, if I take a deep breath in, we see my ribs expand, my diaphragm flattens, right? It doesn't take a lot of work to do that. But shallow breathing, that little bit doesn't bring enough air in. That's what this looks like, because I can show you why as part of this. And an EMT needs to be able to know this. You won't look at a patient on the ground and pull out your calculator and say, oh, look, they're only bringing in 1,500 milliliters per minute. You're not going to do that. But you need to know this concept behind it when a person is breathing very shallow, so it tells you what to do. We have to ventilate them with a bag valve mask. Put a mask over their face, we squeeze that bag, and we have to breathe for them, even though they're making a little bit of respiratory effort. All right, remember I told you there's going to be a test? Let's do that test, all right? So, this is a baby, right? And you get kid calls, and you're tested on how to take care of kids just like you are taking care of adults. A 9-month-old patient had a stuffy, runny nose, cough, fever, irritability, sick little kid, and poor feeding for a week. Oh, that's not good. Over the last 2 days, the patient had a hard time breathing. Their skin is slightly pale. You'll find out why in this class, why skin becomes pale. There's a little tease. There's a lot more to learn in EMT class ready. And it's clammy, it's wet, it's moist. You know, the poor baby looks sick. There's adequate chest rise, and diffuse means it's all over. Bilateral, ooh, look at that, bilateral. Let's do another med term. All right, bilateral means two sides, means on each of the lungs. Diffuse, bilateral wheezes, that noisy musical sound, are listened to. Vital signs, pulse is 124, respiratory rate's 44, blood pressure is 94/54, heart rate is 126, saturation is 91%, the little oxygen saturation, the pulse ox you put on the finger. Select the 2 treatment options that are correct. Now, I don't expect you to know the treatment options here, but let's look at this kid, right? This kid is sick, but let's think about the breathing. Is he breathing adequately? Look, adequate chest rise. He's making noise like wheezes. The vital signs, you'll learn vital signs. The vital signs are good. This question, which is just like you'll see on your national exam, basically says, select 2 treatment options that are correct. So we have 5 choices, and we have to choose 2 of those. It's called a multiple response question. You need to be ready for this. Am I going to do chest compressions? Push on this kid's chest? I don't think he's that sick. Suction the nasal secretions. Well, that sounds like stuffy, runny nose. I kind of like that. Administer oxygen. His saturation is 91%. I think maybe get that up a little bit. Administer an epinephrine autoinjector, like with an allergic reaction. No, not good. And assist ventilations with a BVM. Well, we've determined that we have adequate chest rise. We have enough tidal volume to make this work. That's how it all comes together. So what am I going to do? I'm going to suction the nasal secretions, and I'm going to give this little one some oxygen, and then take them to the hospital, and they're going to be okay. This is how the physiology, the study of how the body works, and pathophysiology, the study of the body and disease, all comes together. All right, one more question, then we're done. You're going to have to go to EMT class ready and get more. This is called the technology enhanced item question. And what you do is you drag and drop. It shows your thinking. You have to sort things. Well, I told you, respiratory failure is shallow breathing. We don't get enough air in, right? We're going to have to ventilate that person. But respiratory distress, dyspnea, is when we're breathing okay, but it's more difficult. So let's look at some of these signs. Respiratory rate of 24 and shallow. I'm putting that into respiratory failure because it's shallow, right? Shallow breathing, not enough tidal volume. Saturation 91%. Well, I might want it higher. Means failure? No, probably not. New onset of confusion. Do you know what happens to your brain when it doesn't get oxygen? It doesn't think very well, and that's a sign of failure. Wheezes in all lung fields means air is getting throughout the lung. That's distress. That's okay. We're moving air. Low tidal volume. See how this comes together? That's failure. And a 3-year-old with intercostal retractions between the ribs gets sucked in because they're trying to breathe hard, but they're breathing, and that's distress. There's 3 in each category. Physiology makes a difference here. We have respiratory failure and respiratory distress, shallow breathing, when they're not thinking well, they have an altered mental status, and a low tidal volume. All of that means respiratory failure. Oxygen saturation, wheezing, retractions, that's distress, but it's not necessarily failure. All right, now, that was some heavy stuff at the end, but you know why I gave you that? I gave you that because I want you to know what you're in for. EMT Class Ready will help you meet the challenges you'll face in your class. It'll give you a head start above other students to be able to get in there, understand some of these deep concepts before you even get to class when you'll learn them again. EMT Class Ready helps get you ready for EMT class with the knowledge and depth that you need.